Currently, more than 107,000 confirmed cases of coronavirus across the African continent. The World Health Organization in Africa has released its prediction of the rate of infections if countries don't adhere to regulations.
Yeah, and ironically, as many countries, including South Africa, prepare to relax lockdown restrictions, the WHO in Africa has emphasized the importance of social distancing, hand washing, and wearing masks as preventative measures. Now, I spoke to the organization's head of Africa Emergency Operations Program, Dr. Michel Yao. Dr. Yao, thank you so much for your time on the AM report. I think on this Africa Day, if I take a look at the meaning of Africa Day, to celebrate and to acknowledge how far the continent has come and to look at our common challenges across Africa. And this year, 2020, those common challenges are all the more different.
Yes, I will say that the actual challenge is COVID, and COVID because it is an outbreak that can reverse most of the gain. If I take the example of health, there are some achievements related to control of, for example, vaccine preventable diseases, as well as HIV/AIDS, TB, and others. And this outbreak, if it's not controlled, can overwhelm the health services that can affect and have over impact. And what we are seeing in countries is that the outbreak do have also economical impact. It affects most of the economics because the lockdown has a huge impact in terms of production and others, and it can also widen the differences between poor and rich. For example, some people that can no more afford to work for their daily living expenses. So this is a major challenge that needs to be addressed not only on the health side, but comprehensively across different sectors.
So, Doctor, as we speak to you now, 108,000 cases on the African continent, headed to 110,000. It's a frightening number when we think about the fatalities associated with COVID-19, but having said that, it is much lower than other parts of the world.
It is likely, it is much lower compared to other parts of the world. Many few reasons. There were some hypotheses that some of them turned into being true, like the younger population in Africa. And so far, most of the cases we are observing, at least the severe or people dying, are those who are more older, as well as those who have other health conditions. We call it a comorbidity. So it's in line of what is happening elsewhere. So the demographics seem to have an impact. The second explanation could be linked to the early confinement or lockdown measures that was taken earlier at the beginning when countries start reporting the first case. They really act promptly, and this maybe contribute to slow down the increase. And we hope that countries took this advantage to increase also the capacity to respond to this crisis. So the danger is still there as we are talking about easing the measures. The question is that do we have enough capacity to monitor the situation, to continue testing for population complying to preventive measures? So these are things that we need to monitor, but the risk is still there.
And as we now, like the rest of the world in South Africa, we're now looking to ease the lockdown measures. As you say, it's not just about a health decision, it's also an economic, socio-economic decision as well to ease the lockdown. But what would be your warning? Are you worried as the World Health Organization as we start to open up the economy again?
My worry may be more on the capacity to manage this ease. One of them is to be able to continue the detection and to see what is the trend. Is it worsening? Is it improving, and where? If it's worsening in a place, a good analysis should help to maybe bring back the measure or reinforce some of the measures that we'll do. So this capacity need to be there. The second one is to ensure that we have also capacity to manage the cases, capacity to treat people that may fall sick, while ensuring that we don't affect also other health condition services. COVID should not stop access to malaria treatments or any other treatment. So it's to ensure that you have this capacity in place, because COVID may stay longer and life needs to continue, as well as other health conditions need to be treated. So to ensure that this capacity is there. And then lastly, to ensure that also these preventive measures, social, physical distancing, hand washing, wearing masks in crowded areas, that these measures are fully implemented, and what needs to be done to implement so is available. You advise having masks in public space, is that you need to supply it to the people. If you promote hand washing, they should have also what is required to do so. So ensure that these measures are effective. So all this in place can help countries to move smoothly, and maybe step by step. It's like opening slowly the tap to test, and then ensure that the capacity in place are strong, and things, life can continue. It may not be life as before, but at least having appropriate measures in place can help the economic activities to start.
Dr. Yao, thank you so much for your time on the AM Report. Dr. Michel Yao is the World Health Organization's Program Manager for Emergency Response for Africa. Thank you.